Your post-sleeve gastrectomy diet, this is stage 1, the clear liquid diet. So after surgery, your first post-op day after they've done your leak test, you will begin on a clear liquid diet. This will be followed for anywhere from 3 to 5 days after surgery. Allowed fluids on this are clear liquids, as stated before, but you can also have liquids that are colors such as blue, purple, green, yellow, but it just needs to be translucent, meaning you can see through the beverage. So things like sugar-free Jell-O, diluted juice or sugar-free juice are fine. You can do popsicles that are sugar-free, decaf tea or coffee, and broth such as vegetable, chicken, or beef broth are all okay as well. You may be able to do certain clear liquid protein drinks, and it's also advised to purchase a soluble whey protein powder that you can mix into any of the beverages that I previously listed as well. Some tips for this diet include trying to get several ounces of fluid each hour. Your goal is going to be about 64 ounces total per day. And if you can get more than that, that's absolutely wonderful. I recommend patients to sit down for anywhere from 1 to 3 minutes every hour and just concentrate on taking a sip of liquid every 20 to 30 seconds. Your sips will be about a half a teaspoon or less. And just watching that second hand on your watch or on your phone if you have a timer, and using that to make sure that you're not drinking too fast. You also want to avoid gulping liquids, as that can cause you to throw up or just feel very uncomfortable. You also want to avoid using straws, as that can cause you to drink a lot of air and thus causing bubbles which translate into burps essentially, which can be very uncomfortable those first few days after surgery. You also want to avoid carbonated beverages for that same reason. And drinking room temperature liquids tends to be a little bit better tolerated than really hot liquids and ice cold liquids. So everyone's slightly different, but that is what we have noticed through many, many patients over the years. Your post-sleeve gastrectomy diet, stage 2, is a liquid-only diet. This begins around post-op day 3 to 5 and lasts until about 2 weeks after your sleeve gastrectomy. This continues with all of the clear liquids that you were previously drinking, and now includes what we usually call in the hospital a full liquid diet. So this includes a little bit thicker liquids like any kind of milk, dairy milk, almond milk, coconut milk, soy milk, whatever your milk of choice is. You can begin doing Greek yogurts, which are really good for the extra protein that you're getting from those. Sugar-free puddings or custards are fine. You can do tomato juice, vegetable juices, diluted cereals like cream of wheat, cream of rice. You can also do soups like a cream soup or any kind of soup that has been strained and excludes any small chunks of vegetables or meat. Some good tips at this point are to continue to avoid any carbonated beverages like sodas or sparkling waters, as those can cause excess gas and even may cause some reflux for you. You want to continue to get about 64 ounces of decaf fluids in at least. If you can get more than that, you will likely feel even better. You also want to make sure that you have a good high quality protein drink or protein shake / powder that you like, and your goal will be around 60 to 90 grams of protein per day for most people, and that really depends on your gender, your height, your weight, and how much weight you have to lose to reach your goal weight. Your stage 3 post-gastrectomy diet is the beginning of the puree diet stage. If you have tolerated the clear liquid and full liquid diet, you normally will begin the puree diet around the beginning of weeks 3 to 4. This diet will consist of foods that have been blended to a very soft, smooth consistency and should be low in added fats and sugars. Good foods to have on this diet include everything that you had with your previous diet stages, including all the clear liquids, the full liquids with milk, your milk of choice, of course, and any protein shakes, powders. This also includes cottage cheese, soups that have been strained or blended, again, to a very soft, moist consistency. You can also have mashed fruits such as bananas, pears, apricots, plums, or other canned or frozen fruits that have been blended again to a very smooth consistency. You'll want to avoid fruits like blackberries, raspberries, blueberries, anything that has a lot of seeds, as those tend to be a little bit more difficult to tolerate. And again, our goal here is to really heal that suture line in your stomach after your sleeves. You really want to allow that to heal properly with very soft, moist foods that aren't going to kind of rub up against it and then, create any intolerance. Vegetables that are really good to puree include spinach, carrots, steamed celery is nice, as well as green beans. Any vegetable can really be tolerated well as if you have a good blender, but those veggies that are really fibrous, such as broccoli, asparagus, Brussels sprouts, tend to be a little bit more difficult to tolerate. Good cooking methods include broiling, poaching. My favorite is using a slow cooker, especially if you're the main cook at home and making whatever it is you want for dinner, and then just taking your portion and adding it to the blender and with a little bit of extra broth or milk for a good smooth consistency. Again, you want to make sure to avoid adding any extra saturated fats. You can use just a little bit of butter. I typically recommend not to use more than 1 to 2 teaspoons a day, and that's only if you're blending some veggies or something and need just a little bit of extra flavor there. Again, also limiting any added sugar or other foods that have a lot of sugar in them. And then, continuing to just blend things really well. Get a good chicken broth, veggie broth that you like. Again, milk can also be a really good thing to add to really help blend those foods that you're eating and making them a very soft, smooth consistency. This is your stage 4 post-gastrectomy diet. And stage 4 starts with soft foods and usually begins around a month after surgery. So at this stage, you can continue to have the clear liquids, the full liquids, and the pureed foods that you had before, and we will just add in foods that you can actually chew now. So very soft, tender, well-cooked foods, but you can begin to use those teeth, so get excited. Usually, you'll have about 4 to 6 small meals a day, eating around every 3 to 4 hours. You'll also want to make sure that you're continuing to drink plenty of fluids, 64 ounces each day at least. If you can do more than that, the better. So allowed foods on this diet include soft, well-cooked meats, vegetables, fruits. You can do a small amount of starches such as potatoes or a well-cooked or toasted bread. However, a lot of the breads, the rice, the pastas tend to be difficult to tolerate for a few reasons. One being that they kind of tend to swell in your stomach after surgery, just making you feel pretty uncomfortable. The other reason is that while they do provide some good nutrition, they tend not to be as high in fiber and vitamins and minerals as your fruits, your vegetables, and then as high in protein, obviously, as a lot of your meats, your tofu, your eggs, your cheese, and etc. So while there's a place for them for sure, right now we tend to kind of and discourage you from having a lot of those and really filling your pouch with the proteins and the veggies and fruits. So good foods to have are anything that you would cook in your crock pot. So if you think of meats and vegetables that have kind of cooked all day long and you just take your fork to them and they tend to fall apart, those are really well tolerated. Anything that kind of has a broth or a sauce or a gravy, again, adding that moisture really helps with the tolerance. You can start to do some more raw fruits and veggies, like a peeled cucumber tends to be really well tolerated. Again, you want to remove any skin on that and the seeds, as well as fresh fruits like bananas, mangoes again that have been peeled, pears that have been peeled, apples that have been peeled, peaches, nectarines, kind of more of those soft fleshed fruits. Some other tips to remember, you want to continue to chew really well, making sure foods are liquid before you swallow them. Also waiting about 15 to 20 minutes before a meal to stop drinking. So drinking, and then once you're going to eat, trying to wait at least 15 to 20 minutes before you begin eating. And then after your meal, waiting a little bit longer, about 20 to 30 minutes. And there's a few reasons for that as well. One, it helps to allow room in your stomach for the food that you're about to eat. So if you drink a lot before you're eating, there's just not enough room then for the meal. And we want to make sure that you're getting the right nutrition and getting those calories and those nutrients that your body needs to do its work, to do its jobs. And then afterwards, though, it's really important because if you have a kind of, a little pouch or a stomach full of food, even though it's a small tube of food, if you begin drinking right away, it can cause some intolerance and it can actually cause you to vomit. It may also kind of push that food through a little bit too quickly, which can make you feel very uncomfortable. If you've had a bypass, it can maybe cause some dumping syndrome. And it can also just make you feel really, really bloated. So waiting a little bit longer, I always recommend people to have, a Tic Tac, an Altoid, or a mint to kind of suck on after a meal, and that can help cleanse your palate and get that saliva moving to kind of, move the rest of the food or any crumbs that are left in your mouth. So there you have it, your stage 4 post-gastrectomy diet.
Got questions? We would love to hear from you in the comment section below. Tell us what else you want us to cover. And do not forget to share and like this video.